the World Health Organization, WHO, has officially declared the fast-moving Ebola outbreak in Central Africa public health emergency of international concern. The urgent declaration followed a weekend of intense, closed-door emergency sessions by the UN Health Agency's advisory panel, triggered by a highly alarming spike in fatalities and rapid cross-border transmission. In a coordinated response today, the United States State Department and the U.S. Embassy in Kampala issued a comprehensive health alert and a strict Level 4 do not travel advisory for the affected regions, urging all Western citizens to evacuate or avoid transit zones immediately. The current crisis is uniquely terrifying to the global medical community because it is driven by the Bundibugyo strain of the virus, a highly lethal variant for which there are currently no approved vaccines or targeted therapeutic treatments available globally, presenting a catastrophic containment hurdle for international medical teams on the ground. According to internal epidemiological data released by the regional ministries, the epicenter remains heavily concentrated within the Democratic Republic of Congo's DRC, Ituri province, specifically radiating through the dense, semi-urban hubs of Bunia, Rwampara, and Mongwalu. The crisis quickly escalated into a Pan-African threat over the last 48 hours as health authorities in Uganda confirmed multiple unlinked laboratory cases directly inside the capital city of Kampala, indicating the virus successfully bypassed rural quarantine checkpoints via commercial transit routes. A third high-profile cluster was simultaneously identified in the DRC's densely populated capital of Kinshasa, confirming a worst-case scenario for rapid municipal transmission. Tragically, the virus has already claimed the lives of several frontline healthcare workers, signaling severe gaps in localized infection, prevention protocols, and triggering widespread panic among local populations who are increasingly hesitant to visit state-run isolation clinics. Compounding the biological threat is the heavily fragmented security and humanitarian framework of eastern DRC, where active militant insurgencies make traditional contact tracing almost impossible to execute. The U.S. Centers for Disease Control and Prevention, CDC, has rapidly stepped up its alert levels, advising neighboring East African nations to instantly activate their national disaster management frameworks and establish stringent screening protocols at all international transit hubs. Public health experts warn that because the baseline symptoms of Ebola, such as high fever and intense joint pain, heavily mimic endemic malaria, the initial wave of infections is likely being underreported, hiding a much larger untraced chain of transmission. As international medical charities scramble to construct makeshift field hospitals and establish strict containment zones, the global community faces an extraordinary challenge that will require immediate, coordinated international financial and logistics interventions to prevent a broader continental disaster.